A life-saving surgery to save an acclaimed doctor from COVID. Dr. Carl Sion is a 51-year-old orthopedic surgeon at UPMC Hammett in Erie. He had been here in Pittsburgh awaiting a transplant since last month. Then, last week, he got one. Good evening and thank you for joining us at 7:30. I'm Meghan Schiller. Dr. Sion had developed pulmonary fibrosis. It's a complication of COVID that leaves the lung tissue scarred. And last week, doctors at UPMC Presbyterian made history performing their first double lung transplant on a COVID patient. And joining me now live over Zoom to talk all about it is Dr. Pablo Sanchez, UPMC's Chief of Lung Transplant and Lung Failure. Thank you for taking the time to talk with us tonight.
Yeah, of course.
Can you explain why this particular patient needed a double lung transplant?
Well, good evening first. He's been struggling with COVID-19 since December of last year. And he went through a sequence of interventions to try to help him recover in some lung function. But eventually, he had transferred to us in the middle of January with severe respiratory failure, completely paralyzed, meaning he was completely asleep on the ventilator. And even though we were able to make some advances in terms of reducing his sedation and wake him up a little bit, his lung function continued to deteriorate. And at that point, all the information that we had based on his physiology of the lungs and oxygenation and gas exchange, and on the imaging from CT scanners and so on from his lungs, we discovered that he had a non-recoverable, or what we call end-stage lung disease. That he had no other option than undergoing the double lung transplant.
How does a double lung transplant work? How do you do it? Do you take both out at once? Is it one at a time?
Well, in cases like his, in which his heart has been struggling a little bit because he was pumping again very sick lungs, we had to use a method of hemodynamic support. So we put him on something that is called veno-arterial ECMO. And at that point, we just removed one lung at a time. I think we removed first the right lung and did the right lung transplant first. And then we removed the left lung and did the left lung second. And after that, we came off ECMO. And he was very lucky. The lungs that he got were very, very good quality. So they took over right away.
Because he was a COVID patient at the time of the surgery, did that present any unique challenges?
Well, I think the challenges that we're still thinking about is how do we define that these lungs are not recoverable? In his case, was somehow straightforward because he was maxed out on the ventilator support. In terms of the surgery per se, it wasn't any different of what we normally experience on patients that we bridge into transplant, meaning he was on ECMO, he was being bridged to transplant on mechanical support. So technically, the surgery was very similar to what we normally do for a double lung transplant. But there's still a lot of unanswered questions of how the virus eventually can affect the immune system and how those may or may not have any influence, or how do we need to run his immunosuppression later.
So people are probably wondering, what does the recovery process look like for something like this?
Well, it's good. It's lengthy. You have to think that this is somebody that is being very sick for 3 months. That he, even though he's 51 and he was super healthy and very active, has had a sequence of hits during these different hospitalizations, and it somehow the condition, even though we work on getting him more ready for transplant, he still has a process of recovery in terms of, mostly in terms of his muscle function and being able to walk a little more and breathe a little more and move a little more. And so I think we're looking probably another 4 to 5 weeks before he can be discharged.
Well, Dr. Sanchez, thank you for your time and best of luck to him in his recovery.
Thank you.